Assalamu alaikum everyone. Today we are talking about the muscles of the spine. We will talk about their anterior aspect as well as after that their posterior aspect. The muscles of the neck and trunk are named in pairs with one left and the other on the right side of the body. These muscles can cause the lateral flexion and rotation of the trunk when they act unilaterally, and trunk flexion or extension when acting bilaterally. Anterior aspect. The anterior aspect, the major anterior muscles of the cervical region are the prevertebral muscles, including the rectus capitis, anterior rectus capitis lateralis, longus capitis, and longus colli. The eight pairs of the hyoid muscles, bilateral tension development by these muscles result in the movements and main function of hyoid muscles appear uh, to move the hyoid bone during the act of swallowing. The unilateral movements are also possible. The main abdominal muscles are rectus abdominis, external obliques, and internal obliques. Functioning bilaterally, these muscles are the major spinal flexors and also reduce the anterior pelvic tilt. The unilateral development by the muscles produce also movement, and in internal oblique causes the rotation of spine toward the same side. External obliques result in the rotation toward opposite side. If the spine is fixed, the internal oblique produce the pelvic rotation toward opposite side. If the and with the external oblique producing the rotation toward the same side. These muscles also form the major part of abdominal wall which protect the internal organs of the abdomen. Now we will talk about the posterior aspect. The splenus capitis and splenus cervicis are the primary cervical extensors. Bilateral tension development in four suboccipitals, the rectus capitis, posterior major and minor, and the obliques capitis, superior and inferior, assist. When these posterior cervical muscles develop only one side movement, then laterally flex. And after that, we are talking about the muscles groups that are a massive erector spine, also known as sarcospinalis, the semispinalis, and deep spinal muscles. As shown in figure, the erector spine group include the spinalis, longissimus, and iliocostalis. The semispinalis with its capitis cervicus and thoracis branches is also shown. The deep spinal muscles including the multifidi, rotators, interspinalis, intertransversi, and levator costrum are also represented. The muscles of the erector spine group are the major extensors and hyperextensors of trunk. All posterior trunk muscles contribute to extension and hyperextension. Now we are talking about the lateral aspect. Muscles on the lateral aspects of the neck include the prominent sternocleidomastoid, elevated scapula, and scalenus anterior, posterior, and medius. and also produce unilateral and bilateral movements. Thank you so much for watching.